Which injection is best for tennis elbow? This is a great question. The answer is none of them. None of them. So cortisone is probably the most commonly offered injection for tennis elbow. What we know about cortisone now is, well, cortisone is it's a steroid. It's a very strong anti-inflammatory, and it breaks down soft tissue. So we know that cortisone can weaken the tendon. Obviously, that's not a good situation. It can cause ruptures in the tendon. That's a possibility. That's when the tendon completely snaps. Obviously, that's not a good situation. It's a very strong anti-inflammatory. And what we know about tennis elbow is that once you've had it for, a few weeks, a few months, even a few years, there's very few inflammatory cells within that tendon or around that tendon at that point anyway. So it's likely not going to have an effect because there's no inflammatory cells for it to work on. It potentially can weaken the tendon, causing ruptures. There are a whole host of other side effects that can happen as well. You can get discoloration of the skin. You can get, it's a depigmentation of the skin. You can get fat atrophy, which means it dissolves all the fat around that area, which can make the elbow, the area of the elbow look different. And it can kind of look a bit strange. It looks like the little bump on the elbow is more prominent because there's less of those underlying tissues there. Along with a whole host of other systemic issues. It can cause facial flushing, it can cause rashes. There's a small, but it's there, a small risk of infection. It's an invasive procedure, so there is always a small risk of infection with any invasive procedure. It can cause sweating, it can cause osteoporosis. There's a whole host of side effects that go along with that. And the fact that we know it's detrimental to the tendon, there's research that shows when somebody has a cortisone shot and is sent for physical therapy, the cortisone shot negates the effects of physical therapy. It makes the physiotherapy or physical therapy not work. And we know it does work. So if you've had a cortisone shot and then been sent for physical therapy, which is a very common prescription for people to get, the physical therapy, you're wasting your time, the therapist's time. There's just, you've negated the good effects that could have. So that's cortisone. So, if you're offered a cortisone shot, the best thing you can say is no. Then people talk about PRP. PRP kind of came onto the scene a few years ago, and it's like, oh, this is the thing that's going to help tendons, yay! And then it kind of didn't. So PRP is, it's obviously not a steroid, it's not cortisone, it's basically taking your own blood, and they centrifuge it, and then they inject part of that back in. There are different types of PRP. There are different strengths of PRP. And it's kind of become so commonplace that you don't always know exactly, what type of PRP you're getting, what strength you're getting. There are so many different kits out there that the doctors can choose from. So my experience with PRP with the people that I have seen who've had it, they always have therapy after. So you're having therapy anyway. I don't see a difference in people who have it, people who don't, and going through therapy. I don't see the people who have had PRP get better significantly faster. I don't see that. For some people, it does make them worse. There's a bell curve. There are always people who are going to feel better from something. There are always people who are going to feel worse from something. I have seen the people that I see the people that feel worse from it. So it's not something that insurance companies pay for. A lot of the times the reason insurance companies don't pay for it is because it's not proven in the literature. It's not proven in research. And so for that reason, I don't advise it. Now, there are other things that you can inject as well. Vitamins, enzymes, placenta, stem cells. I mean, there's a whole host of things that people have tried. And the reason that they're trying all of these different things is it's really challenging to know how to heal a tennis elbow. There is not one injection that will heal your tennis elbow. There just isn't. If you're going to go and have PRP, you are going to need to do therapy after. It's not a one injection and you completely find the tendons healed. It doesn't work that way. So I think people are, so often looking for the magic, the silver bullet, the magic thing that's going to work. And then they're sorely disappointed when the injection that they've paid thousands of dollars for doesn't work out to be that. Or the surgery that they've paid thousands of dollars for doesn't work out to be that. And they realize that, I have to do therapy and I have to put the work in and I have to put the time in and I have to follow the steps, but then that is going to help me. So just do that from the outset, do the therapy, do the things that you need to do, follow the steps. The information is out there. Get my book. My book gives you the steps. It follows the steps. Tennis Elbow Relief 2.0. You can find it on Amazon worldwide. It gives you every step that you need to follow to heal your tennis elbow, to heal the tendon. Now, if you've got other stuff going on, maybe you've got a shoulder problem, maybe you've got the nervous system issue, maybe you've got a neck problem, maybe there's other things going on as well that you're going to need skilled input for, you're going to need skilled therapy for, add that in too. But there are no shortcuts. So do the work, get it done, and you can heal your elbow. See you on the next video. Bye.